All right. Next, we're going to do all of our posterior capsule tests here, kind of testing for posterior capsule instability. So we're going to do the posterior glide at 0, the jerk test, and the posterior translation at 90 degrees, all testing for instability of that posterior capsule. So the first thing I'm going to have my patient do is we're going to flex to 90 at both the shoulder and elbow while keeping the shoulder in neutral. So the hand is just kind of coming right across the body here. And I'm going to put one hand behind my patient's glenohumeral joint just so that I can palpate for any motion going on in the capsule. And I'm going to provide some axial compression, kind of pushing right in there, feeling if there's any excessive motion coming through that joint, if I can feel that humeral head popping out of the glenohumeral joint. That indicates posterior laxity or instability. Next, for the jerk test, I'm going to adduct my patient a little bit. I'm again going to have my hand behind here, kind of having two heads on the supraglenoid and two fingers on the supraglenoid, 2 fingers on the humeral head, so I can really feel for that movement. And I'm again giving some axial compression. You're nice and sturdy there. So that would be a negative. Positive would be any excessive laxity, which would again implicate posterior instability of the glenohumeral joint. Finally, for the posterior glide at 90 degrees, we have our patient abducted to 90 degrees. I'm again going to put my hand behind the patient's glenohumeral joint and just give a little bit of downward motion, once again feeling for any excessive laxity which would implicate posterior instability of the glenohumeral joint.